Hey everyone. Welcome back to the channel. Today, we're tackling a question I get asked a lot. Can you get laser hair removal while breastfeeding? Let's break it down further. First things first, laser hair removal is a cosmetic procedure that targets hair follicles using light energy to reduce hair growth. Laser hair removal is non-invasive, but during breastfeeding, we must always be cautious with anything that affects our body. So, is it safe to get laser hair removal while breastfeeding? Well, there's no clear-cut answer. Here's what we know so far. There's limited scientific research specifically on laser hair removal for breastfeeding women, which means the safety data is sparse. The laser targets hair pigment without reaching deeper layers of the skin, so it doesn't directly affect breast milk or the lactation process. The laser works by emitting pulses of light that are absorbed by melanin in the hair, which damages the follicle to inhibit hair growth. If you want to get rid of your unwanted hair in just 14 days permanently and naturally at home, click the link in bio and try item number 1 or item number 6. However, some medical professionals recommend caution, since hormonal changes during breastfeeding can make skin more sensitive. Hormonal fluctuations postpartum may alter skin's response to the laser, increasing the chance of pigmentation issues or burns. Some breastfeeding women may experience more sensitivity or discomfort during the treatment compared to those who aren't breastfeeding. Always consult with your doctor and laser technician before undergoing any treatment while breastfeeding. A good laser clinic will ask about your breastfeeding status and may modify settings or suggest postponing until you're done nursing. If you decide to wait, remember, the laser process typically involves multiple sessions spaced weeks apart. But don't worry, there's no evidence to suggest that laser hair removal directly harms breastfeeding or your milk supply. Many women successfully undergo laser hair removal while breastfeeding without any adverse effects. But again, it's on a case-by-case basis. One concern is the use of topical anesthetics, which some clinics apply to numb the skin before treatment. Topical numbing creams may contain ingredients that aren't recommended during breastfeeding, like lidocaine. If a numbing cream is necessary, ask your clinic if they offer breastfeeding safe alternatives or suggest skipping it. Some clinics can work with numbing options that are safer for breastfeeding mothers or reduce discomfort through other means. Remember, anything applied to the skin can potentially absorb into the bloodstream, so it's always best to double check. On the bright side, laser treatments only target specific areas of your body, so you can choose spots far from your breasts. Areas like your legs, underarms, or bikini line might feel safer to treat during breastfeeding, compared to areas close to your chest. Laser hair removal is relatively quick, but the treatment might be adjusted to be gentler if you're nursing. Even when breastfeeding, the side effects of laser hair removal remain the same: redness, swelling, or mild discomfort. However, your skin's heightened sensitivity while breastfeeding could slightly increase the chance of side effects. Make sure to stay hydrated and take care of your skin before and after the treatment to minimize any adverse effects. Breastfeeding can sometimes leave you a little tired or dehydrated, so it's important to take extra precautions. Proper aftercare is key. Apply cool compresses, use gentle moisturizers, and Avoid sun exposure on treated areas. And always use sunscreen on any area that's been lasered. Your skin can be more sensitive post-treatment. Sun exposure can cause hyperpigmentation on laser-treated skin, which is a greater risk while your hormones are fluctuating. Some women also experience pigmentation changes in their skin after pregnancy, which may affect how laser treatments work. Pigmentation changes are usually temporary, but it's another reason why some clinics advise waiting until after breastfeeding. That said, laser hair removal can still be a safe and effective option for many breastfeeding women with the right precautions. Always check with your doctor first, as they can assess your individual health and advise whether it's right for you. Research the clinic you go to and make sure they're experienced in working with breastfeeding clients. A well-trained technician will know how to adapt the procedure to meet your needs and make sure you're comfortable. Be mindful of any allergic reactions you may have had in the past, especially to the numbing agents or cooling gels used. Some clinics might offer a patch test on a small area to see how your skin reacts before moving forward with full treatment. Many breastfeeding moms report no major issues during laser hair removal treatments, but it's always better to be safe than sorry. If you have concerns about the safety of your baby, rest assured that the laser doesn't affect milk composition or flow. Since laser hair removal doesn't involve chemicals that enter your bloodstream, it's considered safer than many other cosmetic treatments. Just keep in mind that hormonal changes can affect your hair growth and results may vary while you're breastfeeding. So, even though laser hair removal can be done, the results might take longer or require more sessions due to hormonal influences. But don't worry, patience is key, and long-term results are usually still great. Prepare your skin well. Shave the treatment area and avoid any harsh skincare products leading up to your appointment. Also, don't wax or pluck the hair beforehand since the laser needs hair in the follicle to work properly. Laser hair removal is popular because it offers long-term results, which can be a big help for busy moms. Many women successfully undergo laser hair removal while breastfeeding, but it's a personal decision. Ultimately, it comes down to you and your doctor's judgment. Prioritize your comfort and safety. If in doubt, book a consultation. A good clinic will guide you through the process and help you make the best decision. That's all for today. I hope this helped answer your questions about laser hair removal while breastfeeding. If you found this helpful, hit that like button and subscribe for more.